Okay, hello and welcome back, everybody, to the Rehab Chiro podcast. I am joined here today by the wise and powerful Dr. Jordan Shallow. So, Jordan is a clinician, a coach, and a co-founder of the human performance education system known as Prescript. Jordan works with elite athletes around the globe to improve their function and performance in their respective sport, as well as in the gym. Jordan is also a speaker and a consultant known for discussing complex topics such as biomechanics, strength and conditioning, and injury prevention. Jordan, how are you doing today?
Good, man. Good. Yeah, like I said, a little bit nervous, but I'm excited.
Don't be nervous. We're both Palmer grads. We have that going for us.
Great. We've just alienated like 17 other schools off the jump. Good
Yeah,
job, man.
everyone from Life You just logged off. That's
They're
funny.
not
Okay.
listening.
Yeah, that's true. Okay. So I have a list of about 10 questions here. We'll go through as many of those as we can in the hour. But the first one is a question that I get like all the time. I probably have 10 or 15 people ask me this every single month. Kind of a loaded question, kind of obscure and nebulous, so you can take it in any direction that you want to. But the question that I always get that I want to pose to you is, how did you quote unquote learn rehab? So my go-to answer is that learning rehab comes from similar to barbell medicine. They have a very similar approach. Is that rehab is learned from your own coaching experience. I always tell people if you're not a coach right now, go back 10 years in time and go be a coach or a personal trainer. That'll give you a lot of exercise library or exercise prescription ability, training people. And then I say that the second thing comes from your formal education, which us as chiropractors don't get a great deal of in the rehab perspective. And the last thing is just your own experience with your own training and rehabbing your own injuries. So, how did you learn rehab?
Yeah, I mean, I think I'm going to lean more into that last one as sort of like the cornerstone. Because one of the things that I realized quickly, so that last one being like personal experience and training. So I think the more you can push your own training and run into these, these third rails and run into these problems and run into, man, I was a competitive powerlifter for years and a quad tear, pec tear. Like you start to become. Seinfeld has this quote. He has a show called Comedians in Cars Getting Coffee. I don't even know if it's still running,
Hmm.
but there's a quote from it that I love, and it's pain is knowledge really fast. And that for me was like, that was kind of a cornerstone, at least in my early days, of how I started to adapt a philosophy around rehab. Because, like, I think having a philosophical approach just means you have a framework by which you ask questions. And I think that really dictates the science. Your scientific enterprise is having like a fundamental philosophy. So for me, it's like, like you said earlier, we both went to Palmer. And I mean, I forget the two classes we may have had on rehab. I remember my professor, she's a sweetheart, but like, that shit doesn't scale. And so you run into these issues like when you push your training, and I'm sure you've had this in your personal experience with your own training, is the stuff you learn is just like, okay, why isn't this working for me? Like I got into a car accident. Well, I was on a bicycle. I got hit by a car, and then I started to go see like respected, and I'm going to air quote respected rehab chiros in the Bay Area. And it's like, what the fuck is this, man? Like I don't know, I was 260 through going through school. Like I was really into lifting weights, and you're trying I'm trying to wrap my head around some of these interventions of like, in that case, it was a shoulder rehab where I had some knee issues when I was like kind of in the peak of my powerlifting air quote career. And like once the terminal knee extension green band came out, and I was like, man, like I squat respectfully, like I don't know, at that time I was probably squatting in the mid 700s. And it's like, unless this fucking green band is, 751, like I don't think this is really gonna scale. So I think I and 100% agree with, the sort of the trifecta that you put together. But it can be hard. Like, if you don't have like an affinity for working out or sports, I honestly think going into grad school, like you're a little bit behind the eight ball, both technically and uh, uh, tactfully. Like, it's the rehab is a process. It's not a thing, right? Like then there's a philosophical difference between things and processes. So, if you don't have that, and then, you're not going to get a job at 24 Hour Fitness as a personal trainer. You don't have time when you're going through school. Like, I respect that. do have time, 3.5 years, 4 years, depending on your program, to get in the gym and start problem solving. And the first thing you have to do is get exposed to problems. So, the research, I think a lot of people, and you and I would agree with this, they may lean in a little too heavily. And I think being able to interpret research actually comes from your own personal experience. Because for me, it's like I knew the relevant literature at the time, I saw it being applied to me, but I didn't see the ability to contextualize. And then I started realizing that, wow, like a lot of this research is probably just a novelty adaptation. Like, when we look at exercise as a rehabilitation tool and you look at some of the subjects, you're like, if you're and this isn't true of all research, but a lot of times, if you take people who aren't working out and you get them to do anything, there's going to be, an analgesic effect of exercise, but there's just going to be a novelty stimulus of getting stronger, which is going to mitigate so much of their issues. But when you're dealing with someone who is really strong, you have to start asking better questions, right? You have to have a little bit more of a robust philosophy. And then that's going to lead you down the road of really going back to the drawing board and starting to look at mechanisms. For me, and not to make the entire hour one question, so I'll try and wrap this up. But like to me, getting back to the fundamental neurological correlates of rehab from a tissue healing standpoint and a unlearning pain standpoint, that really kind of set my philosophy moving into whatever my last decade of practice or whatever it's been.
Awesome. Yeah, I agree with all that. Yeah, it's I think one of the core aspects or things that you just brought up is that rehab is not like a thing. It's like this process, and it's always a loaded question when patients or clinicians or students ask me like, "How did you learn how to do this?" I'm like, it's honestly a lot of just trial and error. Like you're just throwing shit at the wall and seeing what sticks a lot of the time, and the research can guide you, but it's all trial and error. So when someone comes to me and it's like, "Hey man, I've got this patellar, tendinopathy going on. How do I rehab that?" I'm like, you've given me like absolutely no context to actually rehab you. I have no idea of like what kind of athlete you are. I have no idea if you're sedentary. I have no idea what your pain is. I have no clue. I haven't examined you yet. So it's it goes along with like how do you learn rehab? It's like you have to go through the entirety of the process. You have to have all these contextual details to actually learn how to do rehab on a specific patient. But yeah, yeah, I agree with you there. Leading into our next question here, you kind of mentioned it beforehand with our education at Palmer, but how do you feel like your chiropractic degree prepared you for the jobs that you do right now? So, was your education helpful, or did you find that you had to take it upon yourself to learn basically all of what you know now?
Yeah, that's a great question. And you know what? I've learned to be a little bit more optimistic in my answer to this. It's like if you're 10 years in and you're leaning on what you've learned coming out of school, you just don't care. Like you probably don't enjoy your job, or you're maybe not having as big an impact. I'm trying to avoid like any sort of negative tropes, but like I'm 10 years out. One, what I learned 10 years ago should be on the road to antiquity, right? I shouldn't be relying on what I learned at school, right? So did it prepare me? It's like, yeah, of course it doesn't. And I think we're so quick to discount that, but because I don't think we understand or we don't respect, and I say we, like I know people who don't really respect what it means to be prepared. Being prepared isn't like what I learned, right? Like, man, I was up if I wanted to keep training during school, so I never missed a workout. So, I'm up at 4:30. I'm in the gym training. I'm on my bike to Safeway. I'm cooking 3 pounds of chicken. Like there's other things that it's going to teach you other than like, yeah, foot on the hose, subluxation. Again, Palmer, shout out. Like we didn't get inundated with a lot of stuff. But hey, look, there was a point where my finger was up a rubber ass, right? Like that happened. Did that prepare me? No, not really. But is metaphorically in the last 10 years, has my finger had to be up a rubber ass? Yeah. So maybe it did, right? So like I think Kairos, we catch heat, and fuck, maybe sometimes we deserve it. Some of our compatriots are out there, doing some wild shit. But like you spend the money, you're going through it. You may as well figure out how, like, pull the positives out of school, use those, but you should be trying to update you should just be continually learning. And if a decade out, you feel like, yeah, no, I'm really chiropractic, it's like, dude, you suck. Like you got to keep the foot on the gas, man. So yeah, man, look, it was a great experience. I made some great friends. A Prescript started out of Palmer. Jordan Junta, who's he's closer than blood. He's my business partner and co-founder. So absolutely. And if you're someone who, and I was like this for a little bit, mostly because of the debt. You're like, yo, what the fuck is this? But if you're someone who finds yourself continually kind of naysaying your experience, it's like you got to change your perspective, man. You went through it, you did it. Money's in the bank now. Like you're fucked. How to unfuck yourself is like you may want to change your perspective. It's a little bit of like an ethereal answer, but like, look, very strong in anatomy, right? Very, if you, especially if you come from a school with a cadaver lab, like, my sister's an ER room physician, and when her shoulder hurts, she fucking knows to call me, right? So very strong in anatomy. Biomechanics, I mean, biomechanics just wasn't what it was 10 years ago, right? But you have the pieces to, if you expand your curiosity, let's call it, you have the pieces to be, very successful. And I think we see there's like a dependency on school to provide us with everything we know. It's like that's not how any program works, man. Like if you were to get a PhD, like you're expected to then carry the profession forward, right? You're not expected to just be an echo of what you were taught. It's like there's almost like a passing of the torch when you graduate. Like when Tassel goes from here to here, your turn, man, contribute. And I think, the consistency in those conversations that I've had around this topic, it's people who are, they're just looking to be a conduit of what they learned so they can pay off their loan. It's like, nah, man, like this is a field of study. Like you have to contribute to it. So if you are reliant on that, on what you learned in school, man, should have got off the pot, dog. Like we're trying to push this thing uphill. Like me and you especially are doing a fucking fantastic job of like, hey, look, yes, Palmer, hole in one, hair flip, innate, we're flowing. Okay, but we're going to move this into the future. You know what I'm saying? So, I mean, again, a long-winded answer to your question, but I think, yeah, of course, man, because what fucking choice do you have? You went through it anyways. You may as well fucking, you know what I mean? But I think there's some ownership over the profession where a lot of people are, it's like a lot of people are defined, or they allow themselves to be defined by the profession rather than trying to redefine the profession. And I think, you do a tremendous job of the latter there. And I think if you feel that way, you should try and, pull yourself up by your bootstraps and try and help us out here. We're taking heat, It's me and you just catching shots in those. It's wild. It's wild.
Yeah, I agree. And like, there's like probably, if I look at my demographics of people who actually follow me, like on my various social media, a large percent of those people are either physical therapists, aides, or physical therapists, DPTs themselves, in addition to obviously chiropractors. And when we look at like, did physical therapy school actually prepare them for physical therapy? It's like they come upon the same quandaries and qualms that a chiropractic curriculum also has. It's like, yeah, you're learning an ACL protocol, but maybe that protocol is from 20 years ago. And then we have something newer that's way better that has higher levels of efficacy to help someone with an ACL tear now. So, same thing. I feel like personally that your preparedness should definitely not be just relegated to what you learned at school, or else you're probably just going to be a shit provider long term. So, yeah, agree completely. Moving on to the third question. This is kind of a hot topic, especially. I don't know if you want to name anyone in particular. I won't name drop here. We'll just keep it at bay, and you'll kind of understand who I'm talking about in this question and the philosophy that I bring up. But what are your thoughts on quote unquote functional training, the fad as it exists right now, and what does it mean to train functionally? And just to kind of set the precedent here and give you my 2 cents, when I think about functional training, I think about basically any kind of training that prepares you for the task at hand, primarily being like your sport of choice, or maybe even just like life, doing like sit to stands and something like that can totally be functional. Things like plyos and calisthenics also come to mind, but also things like general strength and conditioning can also help you out for whatever sport or endeavor you have. But what does functional training mean to you?
Yeah, I'm gonna come at this at a few angles. One, to maybe like come at like the core of the question. I don't really think about it. Like I understand the fad, I see it, I see the inundation, but I don't really have time. Like, and I think it's like I don't, and I used to, man, dude, when I first started, anyone could have copped it. anyone, mom, dad, chiro, physio, if you espouse a viewpoint that I found to be offensive, look out. Look out. Like I'm coming in hot. But I'm like, fuck, man, like it's so draining. And I see it, like what the big news, like Huberman endorsed functional patterns. It's like, yeah, yeah, dude. Whatever the fuck ever, man. Like he's not who I looked like. His PhD is in what? His lab is around like neuroscience,
Yeah.
specifically around the eye, right? If I'm not mistaken. It's like don't license people the authority outside their domain of expertise, and life is going to be good. Like I don't go to my accountant to get my tattoos, right? It's like okay, like this guy trains that way. And you know what? I bet you if I sat down, if man, you know how like dinner, me, you, and Huberman at dinner would be fucking sick. It would probably be the best. He'd be fucking telling stories about womanizing and like hoes and area codes. Like it'd be dope, bro. It'd be so dope. Do I give a fuck if he swings a kettlebell and punches a cable? Not even a little bit, bro. Not even like what shit. What you eat don't make me shit. So like that's like I think a big thing with this whole is like I got shit to do, number one. So, dedicating time and energy and really like those being the two most precious resources, like towards having a formalized thought. It's like, oh, what's Buddy's name? The patterns guy. He looks like a
Naughty
melted gummy
Aguilar.
bear. Yeah, sure, dude. Like whatever the fuck ever. You want if dad bought it up, like you making cheese? He's making cheese. I know that guy's making cheese. Like, all right, cool, bro. I'm gonna go make my cheese over here. I'm gonna do what I do. So that's one. That's one. We're gonna put that over there. We're gonna lead off with the positive. And then secondly, like if I were to define it, it's like, okay, if I were to use the term functional in working with, biped human beings, I'm probably going to look at fundamental principles of ventilation and gait cycle, right? Ventilation and locomotion, right? If we want to talk about human function, walking and breathing, the intersection between the automaticity and sort of voluntary control, I think is interesting. But I think when we look at sort of like midbrain function and cerebellar function of ventilation and locomotion, and the postural implications that that may have, like our preferred automaticity in the way that we contract certain muscles to respond to our environment, I think does pose an interesting question. The answer by which is like you just get stronger, really, like at the end of the day. So, I mean, I dig on the neuroscience component of it, but only so much as that it allows me to solve problems faster, right? I'm not in the interest of getting so ethereal that I'm sitting down reading papers as a part of my treatment. It's like, no, 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 like I have to do something about it, right? So as much as I like looking at, cerebellar subsystems and sort of figuring out this internal motion capture system of the body and how sort of this iceberg under the surface of our autonomic nervous system is really at the driving or at the driver's seat, sorry, of like the way that we move. Yeah, okay, cool. I'm going to close the book now, and I have to train someone. But I think there's a metaphor there where like that complexity inside the case allows for more precision of movement to like sample a watch metaphor, right? Like the difference between a fucking Hublot and a Richard Mill is a Hublot is a fucking dog shit watch that has really uncomplicated movement, and it's as a byproduct not going to be nearly as precise as some Swiss made fucking $1 million thing. Like yeah, is a watch deliberately complicated? Yeah, complications are literally how we value watches. It's like look how dumb this thing is as far as like why did I could just get a fucking an Apple Watch or whatever. But the complexity with inaccuracy is useless. But when complexity leads to simplicity, that's sophistication. And I think you should examine your process and function, I think, may be a good foothold to like, okay, what does it mean to be functional? Like have a can response and dig into the correlates of function as you see it, but only as so far as your answers allow you to move quicker in application, right? Like when I see something, one of my jobs right now is pretty interesting in the rehab world, and it's a complex post-op knee case, but when I have to progress or regress really quickly, I'm drawing on a lot of in-depth neuroscience that I've kind of dug into, and it allows me to be like, oh, saw this, we're going to do this. Great. But don't get to the point where you're so wrapped up and enamored in some of like the principles that when you see something, you start questioning yourself and you start slowing down because it's like that's the real science, right? So when I think of function, to put it in a certain box, like yeah, walking and breathing, just given the fact that you're respecting the fact rather that the autonomic nervous system and our how that how that allows us to respect the environment's role in the process, I think is super useful. And locomotion and ventilation are the two most ever present autonomic, but also voluntary. Like, I don't know, I think I have a spleen. I would assume I have a spleen. I have no reason to think I don't have a spleen. But like the autonomics got it. And it's not like I could sit there, and maybe I could if I like took enough shrooms and meditated enough or like whatever the fuck. I don't even know how you do that. Perhaps I could tap into like the goings on of my spleen. Probably not, though. But walking and breathing, as they do have an autonomic sort of control to it, there's a conduit by which I can tap into that. And I can start to make voluntary changes in something that's otherwise autonomic. So those are I think, core tenets of what I would deem quote unquote functional. But then like maybe a third answer to the question to kind of mirror what you were saying is, and this is the more widely accepted term is it's really it's task dependent, but it's goal dependent at the end of the day, right? And task and goal could be seen as the same thing. So everything could fall under the umbrella of functional if we open our conceptual aperture up and open enough. So there is a mode of thought where, what are you trying to get done? Okay, then this exercise, as so far as it serves that goal or task, can now be seen through a different lens, which is which I is a framework I work off of all of the time. And I'm kind of looking through all three of these at once. Um, so yeah, I mean, it's functional can mean whatever it means to you as long as it doesn't slow you down, right? Both in like your treatment and also just like the energy that, I'm not, I can't get involved in the knife fights with gummy bears, right? Like it's just not in me. And if one of the dudes, if buddy, what's his face was, he wanted to work out. Yeah, I'd swing a kettlebell. And not my goal, but like I'd hang out, I'd go to the gym with him. Like I have no I have friends with different religious beliefs. I have friends with no religious beliefs. I have friends that are purple. I have friends that are yellow. I have friends that are green. It's like I have friends that are keto. I have friends that are I don't care. We're gonna be dead real soon. One key's already turned, dog. Like it's going new. You watch the news? It's not good. So yeah, I mean, maybe a little bit too up in the air, and but so hopefully you're able to pull something out of that. But I think kind of three buckets you want to look at. Um, I think maybe the more technical one, if you want to pull on a rabbit or pull on a string or go down a rabbit hole, is if you want to look at the neurological substrates on the autonomic level from locomotion and ventilation. Very interesting. Very interesting how they have unconscious or subconscious dictates in the way that we move. But think of the watch analogy, your application has to be very simple.
Yeah, I like that. So speaking of ventilation, that kind of leads us into our next subject, our next question here, question number four. What do you think about the push for quote unquote core stability in treating low back pain in particular? So are exercises like dead bugs, bird dogs, and curl ups a part of your typical rehab, or do you find yourself going straight to the barbell?
I mean, let's get the it depends out of the way real quick. So we're gonna put that over there. It's just like a boilerplate thing. Okay, so core stability. I mean, I think it's worth defining stability and its role and how we achieve it because it is something that it is ever present, right? Like it's the ghost in the machine. Even its lack of presence or its presence, it's all on a continuum, right? It's all on a continuum of our environment, kind of like we alluded to earlier. How does our external environment dictate our internal demand? Right? That's a fundamental precept when you put a person in a particular exercise. It's how does the environment have some of that unconscious or subconscious, um, how does it make a, or how does it elicit or demand a response? So I think to understand this from a through a rehab lens, I'm going to sample kind of a principle that was so eloquently summarized by a very close friend of mine, Kyle Baxter, who's a physio, and he once just put it so simply. He's like, "What is this person's relationship with gravity?" Right. And I think that's something as a rehab professional that's really like a fork in the road, first question, first order question or relationship that you need to understand. And because if you get into this field, you're likely physically active, right? You've likely played sports, you're probably still training, but you're going to have patients that come in, you know, I'm not going to give away too many details, but someone past the age of 60 has never trained a day in their life, post-op full knee reconstruction with like a ton of complication. I can't like I need to be like a term that I like using or this idea is a physical empathy. I have no idea what it's like, dude. I don't know. At my I hate to use at my prime, like I'm old and washed out. Like back in my day, like I don't know, what was I squatting two and a half, three times body weight, maybe, like give or take. And yeah, probably like yeah, three times body weight. Yeah, look at me. But it's like my relationship with gravity, I'm on the fucking moon compared to most people, right? Like, and I'm not, it's almost impossible. It's like, unless I go, I get a couple of, I think I got some LSD over there. If I go drop two, and then it's like, whoa, like I'm experiencing new colors I've never experienced before. But until I'm fucking, two tabs deep, like I'm not experiencing that. And it's when you're dealing with a client you have to understand the relationship with gravity, right? And understanding the relationship with gravity, especially when it comes to the core, how does the position of the center of mass affect that automaticity of some of the deep spinal musculature, like if we're talking about the spine passively here, how does that dictate their internal, how does the external environment dictate their internal demand? Well, their center of mass, how do they carry it? Right. Given if they're a little bit wide around the midsection, what is their base support? I use the analogy. I mean, I use a lot of analogies, but I think of how do I want to go about this? I think of like there's a Boeing documentary about like the airplanes that were going down. If you ever get a chance to watch, it's pretty interesting. And basically, they talk about I think it was a 737 Max 8. It was like a particular aircraft that during I think it was like during COVID couple of them started to go down. Like, what the fuck's going on with these stupid planes? And what happened was they put an engine, and it was like this bigger engine, it was a little bit more fuel efficient. And the way that the planes were configured, they couldn't put the engine under the wing. So they sort of put it like in front of a little bit above the wing. And then that obviously is going to change like the aerodynamics and the pitch and the yaw and all and the roll of the thing of the aircraft. So they wrote a software that automatically changed all of the instrumentation to reflect this change in the way the plane carried its center of mass in its most simplest form. But the software backfired, right? The software wasn't able to accurately interpret the position of the hardware. And when I see people and we talk about core stability, we kind of have to get to that root first. It's like, is the software interacting with the hardware? Right? Are we getting, does the body have an accurate representation, or sorry, does the brain have an accurate representation of where the body is in space? Right? Because that's going to be a cornerstone of really just the necessity of core stability or strength or however we want to go about it because it that tells us like well what is the demand on the core to begin with because I think when we look at injuries because there's this is the end of the podcast we're going to answer this question for the next however long by the way I got time if you got time so I an hour is like it's a soft hour
Okay.
okay so we got to first delineate the difference between pain and injury. Okay. Because injury is tissue damage that we need to heal. And an injury is a byproduct of applied force greater than tissue tolerance. Okay. So a lot of the rehab world gets very fixated on this principle, but from the wrong vantage point. And really, any vantage point that's just singular and not plural is the wrong vantage point. And what they do, and what I mean by that is an injury when we look at it from a rehab perspective, and we don't, and putting aside the fact that pain is different than an injury, we'll get to that. But if an injury is then pinch and zoom and it's two concepts of applied force and tissue tolerance, just like lady who gave me terminal knee extension for my knee pain when I was squatting 700 plus, oh, you're looking at this in some weird tissue tolerance standpoint. Like, you're just thinking, oh, well, the knee is unfit to hold up to the weight, so we're going to strengthen the knee. You heard me say 700 plus pounds. What kind of magic band is this? But I think the better question to ask is why are we applying so much force to that knee to begin with? Now we start looking at things a little bit different because I have both knees, both are squatting, right? So why increasing the tissue tolerance? Why is that going to be my way out of this, right? And now again, you look at that situation from a novice perspective. My left knee hurts and I'm an office worker who's a little bit overweight. Oh, all of a sudden this novelty of this intervention gets results. So this person has probably seen 15 knees this week. If all of them are undertrained or detrained, the band works, the band's batting 1,000 until I walk in, right? But then you have to start asking yourself a deeper question. So now it's like, well, why are we applying so much force to begin with? Now, so that's a way to look at injury in the continuum of rehab. Now, when we get to pain, and I swear I'm going to get to core stability. Like we're off, like we're out, they were out there. I got a plan. We're going to bring it back into orbit. But when you look at an injury and you compare it to pain, people think that these two circles of a Venn diagram are one circle. They're not. And we have cases, and we know this, right? Like uh, British Medical Journal posted a case study. Fuck, I forget when, but a guy that fell off a ladder at a construction site and a 15 centimeter nail. What's 15 centimeters? Like 6 inches, maybe? Yeah, 4 inches. Yeah. So sorry, trying to Americanize it for our friends here. Um, Went through his boot. And they were pumping this guy with morphine and Dilaudid. Because, like, yeah, dude, the fucking nail goes through your boot. You know what the kicker of it was? Nail went between his toes. Didn't go, yeah, went through his boot, but didn't go through his foot. But the pain he experienced, they were fucking pumping him full of drugs, and they get him into the X-ray, and they see that, oh, there's no tissue damage, but there's a presence of pain. And then the bitch of it is, and we know this one just, given our vocation. What's the research? When was the research done? I don't know, in the 90s maybe. 100 subjects, MRI, asymptomatic, lumbar spine, 52% seem to have disc protrusions. Like, oh shit, now we got tissue. You said asymptomatic? So we have tissue damage and no pain, and we have no tissue damage and pain, right? So like we are dealing with this continually influx overlap of injury and pain. And when you're rehab, what are you trying to do? Like, what's your priority, right? So now when we get to low back and lumbar spines, we kind of bring this back into orbit. We talk about stability. It's like stability is a contested word. And it's like I think it's a very efficient word. I think it says exactly what we need it to say. But I think what people lack is understanding the neurological correlate of what we call stability, right? And I think when we look at the neurological correlates of stability, we actually find or we can extrapolate a very principled based approach to to this as a training concept. And we know it's a training concept. Leg press, squat, stability. Different stability, right? Like I don't have to worry about co-contracting and organizing and managing my pelvis and my spine. What a luxury. I just let my legs do leg things. But that difference in external environment changes the internal demand. So what are you trying to accomplish? Are you just trying to like have your legs just be these output engines that just push stuff out? Or is there a demand or a need to sort of sharpen the positional awareness of where your body is in space? So when you look at stability and you're like, okay, well, what is it? Right? Pat Davidson would famously say stability is how likely something is to fall over, which I love that. Like I fucking love Pat is the fucking just when I mean he's a modern day, he's on a Mount Rushmore for me. Modern day, he's the fucking man. Um, so getting to know him is really cool. But him and I like we have a diagonal way of looking at this to a certain degree. And we've done seminars together and he's absolutely brilliant. So, definitely give Pat his flowers. And I'm just going to kind of go down my route and say, okay, let's take, let's make something unstable. So the classic example is this going from standing on two legs where our center of mass is in between our base of support. We're stable relative to being on one leg, which now our base of support is minimized and our center of mass is more liable to move outside that border of that base of support. So let's say, for example, someone who can't even do that. Right. So you can't, what is happening? It's like, well, the autonomic part of our nervous system, which really prioritizes not falling over, to Pat's point, uh, is co-contracting and it's basically trying to feel whether or not our center of mass is over a base of support. And how does it do that? Well, there's a couple of ways that our body creates this motion capture avatar of itself in itself, right? And our visual field, and this is like where balance comes in. And balance is fundamentally, from a neurological perspective, different than stability, right? Balance has a lot to do, and balance is integrated into the process of stability. But when I think of stability, I think of the muscular component of controlling our skeleton to keep our center of mass over our base of support. And when you look at that, you say, well, okay, what is telling us? Like I've done this fucking 10,000 times. When I put someone on one leg and I watch then their foot kind of do this, right? It's like they will self-diagnose, or maybe they've been conventionally diagnosed, which is often the case. And a shame to our physical therapy comrades for letting people think that their ankles are weak. It is, but like just let's linger on this for a second because it's very important, especially if you're a student, to start to ask better questions. It's easy and borderline lazy if I put someone on one leg, and whether it's just like some stork pose or a single, or you're doing a Trendelenburg, whatever the fuck waste of time that is, and you look at the foot and ankle, and go, oh, the foot and ankle is weak. It's like you're doing it again. You're doing it again. You're doing the thing where you think it's a tissue tolerance issue rather than applied force issue. You need to be able to change your vantage point and see things from a more integrated perspective. Because guess what, dude? There's not enough cross-sectional area of the musculature that controls my foot and ankle to be able to ever control. I'm fucking, I don't know, what am I, 260 right now? Like it's not, that's a heavy soup can, dog. That's a heavy soup can exercise. Like ain't happening. So the better question is, well, why are we applying so much force to that to begin with, right? So when we look at that basic, our internal environment or our internal environment reacting to our external environment, what's happening? Well, our muscles, like when the foot is shaking, you're watching this excitation inhibition loop, this reflex, and that's all being driven, well, not all, but primarily being driven from the muscles that are loaded, and some of the other like arms might start flailing everywhere. You're not consciously controlling that. This is below the surface. This is the iceberg of our automaticity driving all of these reactions, and they are reactions, and I would say almost reflexes. So what's happening? Let's zoom out and say something like very. Let's make it very rude and start to label this in a way that we can understand. So let's say we get someone to do a single leg RDL, and the foot's fucking all over the place, and they look like they're like on a crow's nest of a ship. They're swaying back and forth, but like, how are they swaying? Why are they swaying back and forth? It's like, well, muscles, let's just pick one, any muscle really, but like, let's say a muscle at the lateral hip. You want to go glute med, you want to go piriformis, you want to go, one of your obturators, a gemelli. I don't care because they're all doing it. When we think about a muscle, all muscles, Paul Ekman, I think, did not a disservice, but Paul Ekman talked about fiber typing and fiber type training, and it was very popular. type 1, type 2X, type 2, whatever, whatever. Uh, and I think the more meaningful muscle fiber types are not fast twitch versus slow twitch, but I think interfusal versus extrafusal. Like if we want to talk about muscles, it's like we have this extrafusal fiber that is the bulk of the contract or is the contractile element of muscle. So when we're on the leg press, and it's not as separated as I'm making it, but just for like academic purposes, let's kind of separate this. When I'm on a leg press, I'm basically trying to hook a car battery up to my brain and just send fucking current out to, motor unit depolarization, sarcoplasmic reticulum, troponin, the whole nine yards. And I just want these fucking things to contract, contract, and push the thing away. When I'm doing something like a walking lunge, I still want that, but I'm kind of governed by these other fibers, right? So when I've hooked the car battery up to my brain and I'm just sort of pumping out this signal to push the sled away, the contraction that is happening is mediated sort of centrally, right? So we have this like motor program, it's like pre and primary motor cortex. Like, look, this is what we're doing. Execute, execute, rep, rep, rep. So it's sort of this mind body dualistic approach to training where it's just like, oh, I got to be tough and keep pushing. And it's like, okay, that's just taking the extrafusal muscle fibers and just having them contract or lengthen and shorten is probably a better way to look at it. And but when we take something like the single leg RDL, which is like not really as loadable, obviously, as a leg press, we're eliciting a different response. The contraction of, that forces us to kind of get into this position where we're at net trying to keep our center of mass over our base of support. Those contractions and relaxations, the excitation and inhibition of these muscles, isn't starting here, right? It's starting at the muscle itself, and it's starting at the relationship of, and I'll focus primarily on muscle spindles, but we could broaden it to proprioceptors more specifically, as long as we contain proprioceptors to like the three free nerve endings that are proprioceptors. Because like we use proprioception very like matter of factly, and we use it too broad. Like proprioception and kinesthetic awareness are two different things. Proprioception is a part of kinesthetic awareness, but it is not, in fact, the entirety of kinesthetic awareness. So proprioceptors are in reference to three free nerve endings: the joint capsules, muscle spindles, and Golgi tendon organs. The intrafusal muscle fiber is defined by its involvement with a muscle spindle. So it's like we have these extrafusal fibers that are contracting, but think of the spaces in between my fingers being the intrafusal. They're coming along for the fucking ride. And when they perceive a change in length, they're the ones that are relaying back to that, I mean, not necessarily to the central command, but to the spinal cord, which I guess technically speaking is part of the central nervous system. And they're relaying through the dorsal root ganglion the two things. And this is where it's really important. And this is where looking at the neurological correlates allows you to have a very sound principle. So when you look at a muscle spindle and you look at the neuromuscular physiology of a spindle and its relationship with an intrafusal muscle fiber, there's two other things. And if you're in fucking school, they're teaching you this shit. You're not paying attention because your neuro teacher is boring and you know it's going to be three fucking questions on boards. So you're fucking off and just on your phone or whatever. But like, don't be the motherfucker that 4 years out goes, school didn't teach me anything. It's like you weren't fucking listening because I'll find the book. I'll go back. I'll find the fucking principles of neuroscience book and be like, see, nuclear chain and nuclear bag fibers, right? So one is relaying the onset of a stretch, and the other is relaying the magnitude of the stretch. And that's the fucking kicker, magnitude. And this then sets us on a path of we need to use load, right? We need to use load to progress this stimulus because our body is responsive to an increase in magnitude. So the increase of magnitude at the onset of the stretch is going to then reflexively cause those extra fusels to make an adjustment, right? So when I see, I can stand on one leg, I'm assuming you would be able to stand on one leg. But the reason I can do that, and there's like a really high order reason, which I mean, I'd love to get into if you had another 4 hours, but let's just like keep it kind of zoomed in at like the basic neuromuscular physiology. It's it's accurate in its prediction based off of its prior exposures of, hey, based off of this change in length and magnitude, I need to have this reflexive muscle contraction to to no longer experience a change in length. So the interfusal feels the extrafusal lengthen or shorten, sends a message through, that pseudo unipolar neuron of the dorsal root ganglion and goes, okay, based off of this, the extrafusal has to do one of two things. It has to either contract or relax. And mind you, at the same time, like the Golgi tendon organ is a part of this with the alpha gamma motor neuron reflex, and the joint capsule is sending, afferent information to the brain. Like it's not as simple as I'm making it out to be. And even what I'm making it out to be sounds pretty complex. But hopefully, again, if you're paying attention in neuro, and this should hopefully, when we can extend an olive branch, you can kind of grasp what I'm saying. So let's then take this principle into stability, right? And let's talk about the lumbar spine. One, muscle spindles, other than our eyes, are the most prominent sensory organ in our entire body, right? So other than our visual field, and like we know this just based off of the neurological real estate that vision takes up in our brain, right? Like we literally have a lobe dedicated to vision. Oh, by the way, it's also embedded into every other part of the brain. So like we know vision is our, other than like peregrine falcons, probably large cats and snow owls, like we're up there. And you can tell by the way, we have eyes in the front of our head rather than the eyes on the side of our head. Like there's a lot of, we carry a lot of predatory characteristics, right? Just structurally. And but second to that, if we were to knock out our visual field, we're mapping our environment with our muscles. Like my eyes are closed. I can tell you with relative accuracy where everything is in space in my body, right? If any of you are interested, I recommend this to anyone who is in Cairo school. Go watch a documentary. It's so funny. It's so profound in our field. And I don't know, I was never taught about it. And I just kind of stumbled across it and I don't know, some bored studying stuff the other day. Or not the other day, it was a while back. It's called The Man Who Lost His Body. And it talks about this guy, Ian Waterman, who caught an infection that created an autoimmune response that knocked out his dorsal root ganglion. And so he was unable to perceive his muscle as a sense organ, and he was incapacitated completely. Right. And then he had to learn, and this is where like the cerebellar subsystem becomes interesting, through his visual field and visualization to start to get control over his body again. But I cannot overstate how important treating your muscle as a sensory organ is, right? There's boomers are out there right now. It's the organ of longevity. It's the organ of the hormone. It's yeah, cool. That and like, can we have the meaningful conversation of it being the second most dominant sensory organ in our body is our muscle, and we can train it as such. And we just need to understand, like, hey, look, as now this pertains to the lumbar spine, there is a high concentration of these interfusal muscle fibers and muscle spindles in the intrinsic deep spinal musculature, because there has to be, because the only information they're getting is autonomic. They're only contracting and or relaxing based off of the inputs of like, hey, is vertebra one sliding on vertebra two, rotating on vertebra two? They're not putting it in that position, but they are responding to the change in position, both from magnitude and a length standpoint, right? So when we look at those MRIs and we see, the infiltration of fat in atrophy of multifidus, and we go, oh, we got to like strengthen the low back or stability. It's like, okay, well, these are two separate things. Because if I am laying on the ground, and now like this grades and they overlap, like if I'm doing a dead bug, for example, the external environment and the internal environment are always, I don't want to say at odds, but interpreting, or the internal environment is always interpreting the external environment. So for me, I look at a bird dog or a dead bug and I think, okay, the offset of the appendage is going to create a net position of a change of my center of mass that my internal environment's going to have to respond to if I want to maintain a certain position. But so if I think of a bird dog or a dead bug for us, if you came in like, oh man, like, I'm on a soft mattress, it's not my bed, I'm getting old now, and I wake up and I'm like, I'm like a little bit stiff. And it's like, okay, the external environment is dictating the internal demand, right? But I'm gonna go train later. I'm fine. Dude, I haven't done a fucking bird dog since Nom. Like, what are we doing here? Because I know that my anti-rotation, my anti-flexion extension, my autonomic responses to these vectors, the direction of forces, is so well trained, right? Like I may start my single arm dumbbell rows a little bit lighter. And the amount of force and change of direction that's going to elicit at this deep spine, where these muscles can't voluntarily contract. Right? And that's the key. When we talk about core stability, I think what we should be keeping in mind in our approach is the muscles that are, when people have disc issues or when people have facet joint problems, usually the thing that's really triggering the pain it are these deep spinal muscles, right? Like if we think of the posterior lateral disc herniation and we think about how that herniation would occur mechanistically with a combination of flexion, lateral flexion, and rotation. And if I have, a multifidus between a transverse process of one vertebra and a spinous process of, several adjacent vertebrae, and I think about that mechanism, sure, it's easy to look at the disc and be like, that's why you're having pain. But it's like you have, and I've done this with a lot of diagnostic ultrasound, the amount of like occult muscle tears you have in your deep spine. And then if you put someone on the ground, sure, that bird dog can be a good entry point into a little bit of change in length and a little bit of magnitude of change in length, which is going to cause that muscle to contract. And we just want to get a foot in the door, but we don't want to start at zero with everyone, right? Because there is a difference between sitting on a ab crunch hammer strength machine where your spine is supported. It's like put all of your deep spinal musculature to sleep and then just have your rectus abdominis and your obliques kind of do this thing. Fine, totally cool. If that's the goal, like you're trying to put on size, you have brick abs and you want to train them for hypertrophy like everything else, drive that action of those muscles and have an external environment that's externally supported or stabilized so you can do that. But a hanging knee raise, a little bit different. Spine's not supported. These deep muscles. So now we have like a more complex sagittal plane. So we have like curl up on one side, which is like, yeah, if you're infirmed and you fucking, you really done yourself in, curl up bird dog side plank, great. Sagittal, frontal, transverse plane exercises that are bookends or beginnings of indexes of particular exercises. But look, if we're talking about stability and we tie this idea of stability to this reflexive autonomic contraction that is driven by the sensory input of a muscle, we have to really respect how we scale and grade the external environment and give us exposures to unstable positions through the planes that we're trying to load. Right. So, how is it that I'm deviating my center of mass outside of base of support? The thing with a bird dog, a curl up, and a side plank, massive bases of support. So, the little bit of perturbation from the change of position of the limbs is going to cause a little bit of perturbation of these muscles and their demand to reflexively contract. But the progression isn't in load. We're not progressively overloading this. We're progressively overstimulating this by finding exercises that begin to deviate the center of mass outside of the base of support. This is where we kind of go from a dead bug to a bird dog to a bear crawl. All of these are now changing those two key components of center of mass and base of support. Because I go dynamic into a bear crawl, there's points now where that center of mass is deviating even further. Therefore, the contraction that's required at the deep spine is greater, right? So that muscle begins to respond. I don't want to say strengthen. I don't want to say uh, be more sensitive, although that's probably more down the route of what I'm thinking with it. The muscle begins to respond. It responds to a signal from itself. And you have to be able to learn how to grade that exposure. And you got to look at it two ways. Grading exposure from the injured, from injury to performance, sure. But then I'm talking like infirmed, like, very acute disc issues or low back issues, but also know how to, on this road of scaling up from, bird dog, dead bug, however you want to organize those, to bear crawl, to contralaterally loaded Bulgarian split squat. That's going to have a transverse plane effect on the trunk to a single leg RDL, which now you have to deal with more shear force, like a single arm dumbbell row. All of those mechanistically are transverse plane anti-rotation exercises, which are going to elicit this reflexive contraction in the deep spine. So know how to go from 0 to 100, but know how to go from 100 to 82, right? Someone walks in, they're like, oh man, like, soft mattress, whatever. It's like, okay, everyone just go back to go, do not collect $200. Like, all right, man, we're good. Yo, time is in this profession, it is about solving problems fast. And the faster that you can solve someone's problem, we're talking cheese, dog. So it's like, if I can learn not only to go, because this is how we look at things, we look at things from the table, off to the gym floor. It's like, how do I go from the gym floor to still on the gym floor and keep them on the gym floor? Right. Like if we look at movement through passive, active assisted, active, active resisted, the only thing that really separates us from good strength coaches or trainers is like the passive part. And these fuckers are doing it anyways now. So it's just like until someone calls the cops, like no one really gives a shit. But so we find pride in our passive and our treatment. It's like, I don't want to touch people. People are gross. I want to leave them on the gym. Oh, that hurts. Okay, boom, regression. We're gonna do it this way. Do this instead. This is all my finger has to do the whole session is just point, and I don't got to poke shit. I don't got to do it. Now, there's a time where when I do that, I take it very seriously. But that's when we look at core stability. We look at bird dog sci-fi. We're bringing it into land now. We were out in Pluto. Now we're coming in. When we look at bird dog curl up side plank, it's like, these are placeholders for remedial external environments that give us remedial demands in our internal environment that allow us to sort of gauge through exercise selection the amount of reflexive contraction needed at the deep spine to control anti-transverse plane, anti-sagittal plane, anti-frontal plane. But they're just that. They're placeholders, they're monikers, they're the first name in the phone book, right? Like you and I, what S is the 16th letter of the alphabet, which puts it somewhere between, I don't know, 68% of the way through, 72% of the way through. If I had to find you in the phone book, I wouldn't open the first page and be like, oh, fuck, he's not there. No, I'd be like, all right, like that's the fucking stupid blur thing. That's 50%. Cool. Let's flip a little bit more. That's 68% or 72%. Oh, there he is. Oh, no, he's not. Let me move a page. And that's a metaphor for exercise selection. So it's like, oh, your low back is stiff. I'm not going to the front page to find you, dog. I'm not. Now, if you're a fucking 100 years old and you just got out of a wheelchair, sure, that's where we find you. But if not, it's like, how can I be very granular in the way that I select exercises? Because, and look, that's just the intrinsic component of lumbar spine stability, because there is the component of the applied force from the shoulders and the hips, and that's a whole other thing. Like, how do we decrease applied force so that the spine doesn't have to be reactive? But I think at the essence of my interpretation of the question is driving home the understanding of the difference between voluntary and autonomic muscle contractions. And really, when I say stability, that's the my brain goes to all of that, right? Like stability, because there's a proprioceptive element as proprioception feeds into kinesthetic awareness of just what happens when a muscle spindle activates or is activated by the change of length of an intrafusal muscle fiber. Our body keeps receipts, our brain keeps receipts. So there's a long-term benefit to that we can get into. But when I think of core stability, I do think it's very useful. Now it's only part of the problem, or part of the solution rather. We have to, to have a complete picture, we have to talk about the outside in applied forces and the mechanics at the shoulder and the ribs and the mechanics at the pelvis and the hip. But I think at the pun intended, the core of this issue is a lack of understanding of that reflex loop, because every muscle has it. And that's another thing, right? We talked about the glute. The glute can voluntarily contract and we can, abduct and externally rotate or whatever the fuck we want to do. But when we stand on one leg and it's now a part of this single leg hinge reflexive response, every muscle has this intrafusal, extrafusal relationship. The only difference is our deep spine, the dorsal rami, that whole group, they don't have voluntary control because it comes off the dorsal spinal nerve, right? All of our other shit, ventral spinal innervation, we're all conscious control ready to go. So they can do both. The deep spine can only do that reflexive shit. So the thing we can do is understand how to put it in the right environment so that reflex is graded, right? It's graded to the response of the deviation of the center of mass and the base of support. So you have a progression regression model of exercises that is that. It's not a progression of like red band, yellow band, green band. I don't even fucking know the colors of the bands and how they relate to one another. It's a progression of those two stimuli. And it's not a matter of being absolute, like this is X number of Newton meters of force in this direction. I mean, you could run the numbers if you wanted. All I need to know is like an ab wheel is more unstable than a plank. I think we could agree to that. Center of mass is moving outside of a minimal base support. We go from here to the fucking, the tire with the thing. Cool. Uh, a a bird dog is more stable than a bear crawl. Yeah, cool. Think of any exercise that has mechanistically that present and just think, okay, well, is it more or less than this? And it's all relative, right? We get so fixated on the objectification of rehab, it drives me up the fucking wall because we're sitting there looking at clipboards and calculators and goniometers, and your clients and patients are coming in, they just want to feel better. So it's like, hey, the subjective is the most objective data point because it's the one we're chasing. Rant over. Sorry, that took an hour. I'm
No,
good
you're
though. I
good.
can keep running. So
No, you're
you
good.
say the word.
Yeah, I think you made a good point. I think a lot of people, when they think
I hope
about
so.
like core stability, it's always about going straight to load to make the task more difficult when that isn't necessarily always the wisest choice. And I think I mean, I used to rag like back on the day. I rag on everything, but I used to rag back on the day on DNS in particular, dynamic neuromuscular stabilization. It's a method of rehab that chiropractors are taught via their they could take like a CEU of it or whatever, take an elective of it. And back in the day, I was like, why the fuck am I gonna get on my hands and knees when I can do a barbell back squat? Like this is stupid. But in reality, it's like could that be useful for some people in some instances, particularly if they never want to even get to doing a barbell back squat to work on core stability? Yeah, probably. There's probably a subset of exercises in there that are wise to use that are also scalable. You don't always have to send someone straight to a barbell and then, do deadlifts and all this other shit to prioritize load so much. So yeah, the I think exercise selection in particular is widely undervalued, and we just kind of throw load onto everything and expect it to get better as if strength is a primary function that dictates if people get out of pain when it's definitely not. So yeah, that's a really good point. But you also brought up something that brings me up to my next question. You mentioned using your hands, so that's my question for you next. So in your current method of practicing, do you still find yourself using manual therapy, or are you primarily just exercise based?
Oh, yeah, I mean, definitely. And that's the bread and butter, man. If you don't have a good set of mitts on you, like this fucking go to 24 hours and be a personal trainer. Like I hang my hat on that shit. But it's, the old one of the a license to adjust is as a license to know when to not to, period. Right. And like when you look at it that way, I can get a lot done with movement. What is the benefit of something like adjusting? And not, we're not going to fixate on adjusting purely in the realm of manual therapy because again, like let's go back to what is happening. And this is a little bit my theory. It's extrapolated from stuff, and it's really relevant to the conversation we just had. Like there are regions of the body that I gotta say most of the time, if I'm adjusting, feet, ankles, ribs, T-spine. I tend to stay away from cervical spine, tend to stay away from conventional lumbar spine adjusting. Just I mean, once you get through the lecture of facet joints and the lumbar spine, and then the next class is someone trying to wring you out like a towel. You're like, sir, ma'am, we just like I'm talking 7 minutes ago. Someone told me that the orientation of facet joints don't facilitate a ton of rotation, like the least amount of rotation. Why am I fucking so like I tend to not do that. Um, so adjusting, I think, is very useful in the proper context. But what is it doing? So for me, it's like we look chiropractic is famous for looking at structural correlates and mechanisms. Like foot on the hose is the most classic, right? What is happening? It's like, oh wow, like that would be great if we weren't chimpanzees with universes for brains. Like, sorry, man, ain't that simple, dog. There's no way. But I think, to the point about spinal adjusting, I think, it's undoubtedly palliative in the right context, without a doubt, right? Like you get a rib, like all the symptoms, and we don't know necessarily what's going on. But if I operate and someone take a deep breath in, okay, hurts to breathe, it rotates, it's here. The mechanism is like some sort of rotational base. We understand the two articulations of the rib, posteriorly on the T spine vertebra. You go, okay, I've done this enough times where I don't know, but if I fucking just do some sort of anterior thing in my hands here and that person falls down, they leave consistently 10 out of 10 with immediately no pain. Right. So it's like, well, what is happening? It's like, well, maybe maybe, stay with me, like maybe when we create movement here, we're actually creating an awareness around that the muscles, I mean the ribs, we think of the ribs articulation with the erectors primarily, but then how that would affect the T-spine and the intertransverse or the transversus spinalis group and its friends. And it's like, okay, creating passive movement in muscles that are voluntarily impossible to contract is going to create a reflexive passive contraction, which is going to start to fire this group. And this gets a little bit more into the central receipts of how these muscle spindle reflexes work. But to kind of zoom out and get to the broader question of manual therapy, it's like I'll use adjusting when I think the neurological conditions dictate it, right? Like, do I need to create tone or inhibit tone in a muscle? How do I do that? It's like, well, I need something to either contract or relax. Well, I can't do that with my brain. I need to do it with the external environment. So if I create external motion, the muscles that are attached across these joints that seem to be, use whatever word, stuck, painful, whatever, I can use the external environment, just like with exercise, to create motion or the intent of motion to fire across these many reflexes through our proprioceptors to then reinstate not only like, sure, maybe we're creating structural movement and reinstating motion, but the more important thing is we're reinstating the positional awareness of those adjacent structures, right? And the same thing is true at mass when we look at manual therapy. Like, let's just take ART off the shelf because that's probably closest now. Patent pending. I don't think I'm up to date on my ART cert. So, Leahy, cut your boy a little bit of slack, please. Um, but what is happening? Like, what are we doing with our hands when we poke on stuff that is moving around? Checks time. Okay, yeah. I mean, again, I'm chilling. So when we think about mechanoreceptivity, right? Like mechanoreceptors, subcutaneous mechanoreceptors. And motherfuckers, I know it's in the same textbook. It's in this. I could see the layers of the subdermal layers. I could see the Pacinian corpuscles and the Meissner's corpuscles and the Ruffini endings and the Merkel's disc. And we think about, like, okay, what is going on? Because if we think of therapeutic modalities across the board, manual therapy aside, foam rollers, Theraguns, kinesio tape, um, what am I missing? Okay, let's enter in like massage, compression wear. That's another one, right? Compression wear, everything from, the fucking guy in the gym. Why does he wear Under Armour pants under his shorts? Right? Is he trying to get a motherfucking scholarship? It's like he probably feels better. And he doesn't, and feeling better and feeling more in the sense of kinesthetic awareness are kind of the same thing, right? So I lend lenience to the knee sleeves and the leg sleeves. Like, you used to watch any basketball player, and it looks cool. And it's really because Allen Iverson may have had racist tattoos on his arms. We don't know, but like skin stretch and light touch are they are our free nerve endings in our subcutaneous then the layers of our subcutaneous layer of our skin that are relaying really important sense data, right? So when you look at, okay, deep pressure, when you look at the free nerve ending that relays the perception of deep pressure, it's deep, right? Like, you kind of be like, imagine, so I have like hairs on the back of my hand. If I were to do that, it feels like light touch. It doesn't feel like the color red, right? Because there's an encoding for when you follow the hair follicle down, you see the furry nerve ending right next to it, and it goes your brain. Oh, I feel that, right? That's a light touch. So when you're using manual therapy, I think one of the big mechanisms is, I think we can all get on board 2025. We're not doing the scar tissue thing, right? We're just not, like, that's not still out there, right? Like, hopefully, and the hard part is, if you're listening to this, they already know, right? How do we get this message to the people who need it? So it's like, okay, if it's not structural in its correction, what is it? It's like, I really think a large part of the palliative mechanisms of all of our therapies, it has to be neurological. But we never ask the question. Cupping. Cupping is to toxins what massage is to scar tissue. It's like, yo, like, what do your weekends look like that you're just like, oh, we got to pull this toxic blood out of you? Like, are you just like, are you on the needle? Is it just straight Fenty and hair on like every fucking weekend? Like, what? But I bet you your skin is stretching a lot in that localized area, right? And we look right through it. It's like the neurological mechanisms of correction are just this glass that we look through to see the wrong answers. And it's like someone has to go up and just put their hand on it and be like, hey, the nervous system, the thing that makes this whole thing run. And so when you look at like mechanoreceptor activity and you look what works, what do people reach for? Man, fucking my athletes, they walk in, they're fucking dual Theragun. But why? Because we have in our subcutaneous layer a free nerve ending that relays positional information when in the presence of vibration, right? Kinesiotape. I have some guys that love it. And what did I mean? I don't. I feel bad. I have some friends who were involved, and Rock Tape is a Bay Area company, and no shade because I do use the product. I just use it a little bit differently. Do not show me the fucking diagnostic ultrasound image of the lymphatic drainage shit. I swear to God in heaven, I'm just gonna. I feel like I'm taking crazy pills. Why don't we ask? Why don't we? Why doesn't someone just put their hand on the glass and be like, "There's a there," right? Lymphatic drainage. You need the fucking muscle to contract, right? The muscle is the heart of the lymphatic system. Putting tape on ain't gonna do shit. But we have, some pretty good meta-analysis that say what tape is good at decreasing the perception of pain. Now, the perception of pain is a whole nother fucking 5 hours, but how? Well, what is skin stretch? For some reason, we've evolved to have this free nerve ending in our subcutaneous layer that responds positional and sensory information in the presence of stretching of the skin to the brain to help us sort of fortify our internal motion caption avatar of our body's position in space. So, like tape, and look, this helps me from a rehab perspective be able to implement some of these tools, right? Like, because I can elicit skin stretch with my hands. I can elicit light pressure. I can elicit deep pressure. I can elicit, vibration's a little bit tricky, but guess what? If I can get someone to load, you don't think fucking there's a lot of vibration when you're jumping around, right? Like you don't think when I'm using bands or cables or whatever and we're actually lifting that all of that sense data isn't present. And then oh by the way, the proprioceptors that transmit to the brain much faster, like almost twice as fast. The like we talked about the mechano or the muscle spindles and the Golgi tendon organs. You don't think they're coming to play too? So like understanding the context of when to use manual therapy and the neurological correlates to the manual therapy you're using is going to allow you to, and this is it's going to allow you to use them much more efficiently. Like when you start to see the manual component in the rehab process through a neurological lens, it allows you to dose it so much more efficiently. Like once that lock is in the key, can't be more in the key. I don't need to be doing fucking manual for 45 minutes, right? And look, I've been cash practice since the jump. If you're trying to get another fucking ICD-10 code after 7.5 minutes and you're trying to get your bills paid, it's like okay, but if you want to sleep at night and do a good job, you're doing fucking 10 minutes, 15 minutes, 20 minutes of manual. It's like this person either needs to get the fuck out and go see someone else, or they better get the fuck off and we got to get moving. Because understanding the relationship between nociception, mechanoreception, and proprioception, this is where we live as clinicians. This is why coaches and strength coaches are better at getting results than we are. Now, they can't break into this, but they have Theraguns and foam rollers now. Like, oh fuck, I better be really good with my hands, right? And knowing where to put them is a whole nother story, right? Like if you're putting your Theragun somewhere, I'd put it somewhere else, or you're putting your foam roller somewhere, I'd put it somewhere else. But that's our point of differentiation as clinicians is we pay for malpractice insurance. We have a license. The NCMIC's got our back if something goes wrong. But the thing is, when you start to look at it this way, a lot less stuff is liable to go wrong. I think manual therapy has its place, and really it's at the heart of what makes us different. But it should also set the trajectory of what makes us better. Because when we understand why we do manual therapy and we take that principle approach and we extrapolate it out into active assisted, active and active resisted movement, your work product is going to be so much better. That's why like the really good strength coaches have this clinical element to them because when you're posed with that difficult a problem to solve and you have the right principles to solve it and you take those principles from solving some of those passive problems and you apply it to the continuum of motion off the table, you're just in a, you're just able to get better results faster. You're asking better questions, you're getting better answers, you're getting better results, and you can provide more value that way. So I'm still very much like, of all the shit that I do, and training is a big part of it, manual is the lifeblood. Like understanding or trying to, fuck, we're all going to be wrong soon enough, and I hope we are, but understanding or trying to understand the neurological mechanisms that make manual therapy effective, dosing them appropriately and making that a part of my service offering is really sets the trajectory for everything else. So it's like it is as big a part of my job as it needs to be, given the patient or client that's in front of me. But philosophically, that is the bedrock of everything else. So get good at it. And the only way you get good at it is maybe a little bit of how or what it's doing. When you learn that and apply those principles off the table, man, you are cooking with gas. You're doing magic tricks. You're doing magic tricks, like straight up. Like people are like, I've had people. I feel like an evangelical preacher. Like people are getting off the table. They leave the gym after and they're in tears. It's like, yeah, dude. Like it's not. Once you get the core foundation that starts with manual, at least in our case, in my case, it did and it does. And you take that, you're just pulling rabbits out of hats. It's wild. It's a wild day at work, man.
Yeah, 100% agree. I have one. I think we'll wrap up on this question. I had a couple more rapid fire questions for you, but if we do them, I feel like we're going to talk for 4 hours because one of the questions was, what do you think about the new science-based lifting fad for hypertrophy training? And I could talk
Oh,
about
that's
that for
short.
12 hours. Oh, it's
That's a
short?
short
Okay, go
answer.
ahead.
Sorry, I don't. No, man, I'm proud of myself on that one. I don't like. Look at you. You're jacked out of your fucking mind. I'd much rather do an extra set or have another meal or sit down with a book than write a post about someone who's smaller than me. And like, I don't, because I'm not trying to be right, dog. I'm trying to be fucking huge. Like, it's what it is. Got one down. All right. I'm down for whatever.
Okay, let's see. Next question and last question is a little bit more of, I guess, like a esoteric, ethereal question, but maybe not. Imagine I'm a clinician paying you for a consult. If you give me one piece of information that I could apply to my clinic today, really improve my clinical practice, what would it be?
I'd give you your money back and tell you to book a one-way flight with it. That's true though, man. And your ability to connect with people will be what dictates your success, without a doubt. And if your head is in the books, and look, like, and prescription has been around for a decade. One of my main ways I put food on the table is by people looking to pursue greater education. And I've talked people off this ledge if I think they lack the perspective. And a lot of times it's early grads, right? And it's like what allows me to be effective in so many different situations and have the opportunity. And it really is an opportunity. Like every time, like it is like a question. And why I love and I was excited that we were able to coordinate this is like, what a blessing a question is. What an like it's such a like it is so cool to be asked a question. To be in a position where someone gives a fuck about your answer is like wild. And you want to find different questions. But when you're out of school, like you just, and trust me, I was so dumb, like so painfully dumb, clinically, pathologically dumb. But it's like I could tell you without fail, like the big breakthroughs I have in building the relationships necessary and the trust necessary to be an effective clinician comes from having a fucking life. And the best part is having a life is awesome. And it's so much it's so enjoyable. So wait, the thing that makes you better as a clinician also makes your life more enjoyable? Yeah, do that. And you know what it is? Thailand is sick. Cambodia is sick. Take the money. I don't know what I'm charging an hour. I honestly I think it's a lot, and I should charge more to deter more people from doing it. just so I can refund them and be like, look, this is a G note. You can get basically anywhere in an 8 hour radius for $1,000 on a one-way flight if you're flying economy. Here's your money back. Talk to me when you get back from Iceland. And it sounds so, but I'm telling you, man, like it is something that when you look at people who are 10, 12, 15 years in and they hate it and you look at their patient base and you go, yeah, I'd hate it too, right? Because it's this people who are as cookie cutter with their lives as you are with your approach. Like you create that environment. But when you're, like I don't know, I'm trying to think of some dumb places that I've been that have led to like very cool conversations and relationships and patience and stuff like that. Like I don't know, pick out of a hat. Oman. I can think of 4 or 5 DMs that I got from people who are, very high net worth that followed my stuff that reached out when I went to Nizwa, Fort Nizwa in Oman. And I fucking didn't sleep for 36 hours. I just got back from, I don't know, Singapore. And I was like, I got a couple days off. And Oman, I was living in Dubai at the time. So I just like went down to Oman and I wanted to check it out. So I like went with a buddy of mine and we like rented a car and like we take shifts. He would sleep in the back and then I would drive. And like that is as a part of your practice as sitting back and reading research. So like don't forget to have a life because no one knows. We can talk and we can rap and it's fun to be able to talk to clinicians and we can kind of have these higher level conversations. But that's not what does it in practice. So, it's not the answer that some people may be looking for, but in my experience, and personally, it's what's helped me out so much. Like I just traveled a shit ton and there's a relatability and a perspective that allows you more to understand like what these people want to do with being better rather than the process of getting better to begin with. And I think that just lends so much to your practice. And maybe it's not, maybe it's not traveling. Maybe it's picking up an instrument. Maybe it's fucking, I don't know, going to fucking some local theater, whatever you're into. But like, have a life because it's way better, right? Like, I'm not a chiropractor. I'm a guy that does stuff, right? But like, what is the guy like be or the girl, whatever, like be that person first, and then it's not don't identify with it and have something because it's tough, dude. Like undergrad, you're around a bunch of like meatheads that are training and career trajectory, and you get into Kairos, so it's kind of like sharp elbows. Like, oh, did you hear fucking hell? You went to the DNS seminar? He's gonna get all the patients in student clinic, dog. Like, it's gonna be wild. Oh, there's an FRC seminar this weekend. I'm not gonna tell him about it. I'm gonna go. It's like, yeah, just chill the fuck out, dog. Like it ain't that heavy, bro. Like I don't know. I didn't go to a single seminar in my entire academic career. I went to the gym and met people and talked to them. So like that, spend your money, you know, go on a trip, go somewhere that has nothing to do with this. Cause like it be in this for the long haul, right? Like I'm 10 years in and I wake up every day before my alarm. Every fucking day. I'm so like, today we get to talk to you. It's like, fuck yeah. Like I love the stuff you put out. I love how sharp you are. I love how like fearless you are. You don't give a fuck. I'm like, I want to tap into a bit of that. Like I'll see him, I'm on this cool ranch. Like, we'll see my client patients here in a bit. Great. But that you can't just redline it. You can't just like try and take these books and just go, "Ugh, get in my brain." It's like, dog, it's not how it works, man. So that's sort of like my final answer.
No, that's a great final answer. Yeah, I think a lot of people who, unfortunately, a lot of people who tap into stuff like this in my podcast are like gonna hear that and be like, oh shit, how do I like be cooler or be more interesting? And I feel like the reality is that you just have to try, you just have to do something. Like it does not matter what it is. To your point, like you could pick up an instrument, like I don't know, take up running. Everyone's in a fucking run club now. Do something, and yeah, 100%. That'll just make you more personable with your clients. And my dad always used to talk about how me and my brother are 6 years apart in age, and he goes, "I don't have to fucking worry about you guys because both of you guys can talk." And I never really understood what the fuck that meant until I was a clinician. And my patients were all like, "Oh, you're super personable. You know what you're talking about." And I was like, "I never thought that growing up, but thanks for saying that to me." And that's what my dad told me all my life. He's like, "I don't have to worry about you guys. You guys are personable. You can talk. It doesn't matter what career you're in. Doesn't matter what you choose. You guys will be okay."
Wise
Yeah.
man.
Yeah, wise man. Yeah, for sure. All right, brother. Well, thank you. It's been almost 90 minutes now. I appreciate your time. It's been awesome. I know we got off on there's gonna be a lot of info in there that I know I'm just gonna get some crazy convoluted DMs about, so I can't wait for that. It's been awesome. What is your tag? I know that people will probably find you on Instagram as the Muscle Doc, but what other things do you want to plug? Websites, anything like that?
I'm Prescript, www.pre-script.com. Um, I write on to kind of my last point. I write on Substack about like philosophy and some neuroscience, so it's like somewhat adjacent. Actually, I would probably say if you're interested in any of the stuff we talked about, the Substack is. I think I don't even know. I started like a couple months ago, so I don't know. Search my name, my dumb face will show up. But that's a little bit more in depth on some of like the neuroscience. It goes more philosophically adjacent than like training adjacent, but like to my point about having other interests, like that's where I kind of go to dump those ideas. But yeah, those would be the main ones.
Nice, cool. Well, thanks again, Jordan. I really appreciate it, and I hope you
Of
guys
course,
enjoyed the
man.
podcast.